Good evening, all. Welcome back to my channel. I haven't been for a while due to a couple of medical issues. Today, I'm going to talk about meaningful risk assessment, which is not simply a document created to satisfy compliance requirements. It should be a practical tool that generally assists in managing workplace risk and protecting workers, client contractors, and members of the public. Throughout my experience, conducting workplace inspections and investigations across operational environments are one of the most recurring issues identified is where risk assessment becomes overlay or generic and are not regularly reviewed or fall or reflect the actual work environment. So I'm going to talk about the risk assessment in a organization or say a health environment, for example, but you can use it anyway. So there are types of risk in all sorts of environments. Risk can be dynamic and change rapidly. This includes environmental conditions, client behaviors, staffing levels, workplace layout, fieldwork activities, psychosocial hazards, and emergency situations. Now, there are various sorts of hazards in the workplace. Example of hazards and risks that should be meaningfully assessed within these environments may include occupational violence and aggression. This could be in a health setting, interview room safety, in a mental health hospital or mental health ward, duress alarm functionality. In emergency in an hospital, you need to press your duress alarms. Fatigue and psychosocial hazards. This could be nurses working in the wards or emergency. Lone or remote work. Sometimes healthcare workers here in Australia have to travel miles and miles to see patients or doing a risk assessment. Same with the client home visits, manual handling risks, lifting objects. Emergency evacuation procedures is one of them. Sharp exposures. So healthcare workers are routinely involved in, say, needle stick injuries, looking into that, security access issues, and aggressive and unpredictable behaviors from um, visitors or patients in a healthcare environment. Now, from an inspector's perspective, as you know, I was a former health and safety inspector for the government. One of the key observations often identified is where controls exist on paper but are either not fully implemented, tested or understood by workers. You could have persons from a non-English speaking background. There's no point showing them a piece of paper if English is their second language. That's one of the examples. As I said, for workers not familiar with the English language, not familiar with emergency procedures. If you're inducted into a new building, another one is duress alarms not routinely tested. Interview rooms containing unsecure furniture um, impacting escape paths. Blocked emergency exits is one of them. I found a huge shade umbrella and chain blocking the emergency exit once in a construction environment. Inadequate reporting of escalation of hazards. I mean, if you don't report it, how's the manager supposed to know their hazards and risks that could have caused injuries? So we need to have a system to where you can report things and then have a statistic-based program where it tells you what needs to be done. Risk assessments not updated following incidents or near misses is one of the major issues. These issues reinforce that a risk assessment should never be just become a tick and flick. Now, documented risk process. So, meaningful documented risk assessment should be a living document that assists workers to identify the hazards, understand the risk, implement practical control measures, and support information decision making in high risk situations. The process should begin with effective consultation involving workers, supervisors, health and safety representative, members of the public, and management. Workers understand frontline duties are often best place to identify. So what I'm saying is workers understanding frontline duties are often the best people to ask when identifying emerging risks and operational challenges. Now, once a risk is identified, the assessment should consider the likelihood of an incident occurring, the potential consequences, exposure to the hazards, existing controls, and whether those controls remain effective within the operational environment. Importantly, the assessment should reflect real operational conditions rather than ideal conditions. Now, control measures should then align with the hierarchy of controls, where reasonably practical. This may include engineering controls such as installing CCTV, secure interview room design, and duress alarms. Administrative controls, including procedures, training, escalation pathways, and supervision, and appropriate personal protective equipment when required. One of the most important lessons from workplace inspections and incident investigation is that documentation alone does not make a workplace safe. What matters is whether the identified controls are practical, implemented, communicated, monitored, and regularly reviewed. Now, risk assessments, as I said earlier, should be routinely reviewed following incidents or near misses, when workplace conditions change, after security or operational changes, or whether workers identify that controls are no longer effective. In closing, a well-developed and meaningful risk assessment demonstrates proactive leadership, supports legislative compliance, improves workers' confidence, and most importantly, contributes to creating a safer workplace for staff, clients, and the broader community. Hope this helps you. I'll catch you on my next stream. Thank you.